identifying opportunities for improvement, implementation of lean principles, engaging in problem solving, and participating in improvement processes. These values were clearly demonstrated by our next award-winning team. Bellin Health recognizes the OR Efficiency Team as this year's recipient of the Values in Practice Award for Team Improve. With a growing health system, the demand for surgical room time has been increasing. But there was a challenge. The traditional way of doing things resulted in late starts, rooms that were booked and unavailable even if they weren't in use, and surgical days that stretched into the evening. That's what the OR Efficiency Team set out to improve.
We were noticing that improvements needed to be made in the surgery schedule. We were finding lag times, waiting times in between surgery. We had surgery scheduled from early morning into late evening.
At first glance, we were over 95% blocked, and what that means is we had providers that had reservations, however not necessarily always using those reservations. So with not having a clear defined process, providers would be holding on to that and other providers wouldn't be able to schedule into those locations.
We had several metrics. One was first case delay, the other was turnaround time for the rooms, and then also how truthful we are with our scheduling.
So first case delay is basically what it says, what the first case scheduled in the day, how often do we actually get started and get in the room and start on time. So when we looked at our numbers, we were dismal. I mean, almost laughable at how bad we were. Approximately 30% of the time we actually got to the room on time and started on time.
So we actually engaged a team to determine the timeline so we could achieve getting to the room on time. So we engaged our staff in the peri-op team, also our surgery team, surgeons, anesthesia, and each component, you need all to make a whole. So we looked at what time the patient arrived and at what points everything needed to be completed so we could make the room time. From there, when we kicked this off, we went down to under 20% delays.
Room turnaround time, the challenge with that was that we didn't have a process for how we turned over our rooms. So we started with PDSAs in summer before we engaged the November 5th start time and developed a plan for EVS to have a structured process for cleaning the room. Previously, our turnaround was probably 12 to 15 minutes. Because of the improvements that the structure that we created, the PDSAs that we had, we cut it down between 7 and 8 minutes.
Truth in scheduling is a attempt, or a pretty good attempt, at using your average times, the computer, to help tell us how long do we actually take.
Prior to implementing truth in scheduling, if a provider surgeon had 4 cases from the hours of 7 to 11, had 2 more patients to operate on that day, it would have been common practice where they would have just shrunk the times of the previous cases so that all 6 patients actually fit in that 7 to 11. However, when you looked at it going into the day, you could see where they would be running really behind. So it was holding them to what their actual time was, and it's from wheels in to surgeon close.
There's potential to add approximately 3,000 cases a year. Just by maximizing our utilization of the OR space compared to our previous model.
The OR Efficiency Project has improved our patient satisfaction by the patients not being here for longer periods of time that they need to be.
The staff now, I think, has a more predictable work schedule, and I'm hoping that what we'll see is more improved staff retention, staff happiness.
I want to say congratulations to all of the staff on our floor. We've worked very hard to receive this VIP award, and I appreciate every one of you. Thank you.
I would like to thank the team that nominated our group for the award, and also to congratulate the rest of the award winners.
Congratulations to everyone for all your hard work. I really appreciate your efforts and look forward to many great things to come.